My name is Derek Vickers, and I'm a program specialist for Insight Human Services. I've been working with school systems, school-based youth groups, adult civic groups, and other community-focused agencies for 5 years in the field of prevention, specifically alcohol, tobacco, and other drugs. I'm here today to talk about youth vape use. In this video seminar, parents and guardians will gain knowledge on a few areas related to vaping, the history of vaping, and the current vaping devices that are popular with youth. I will share current youth use rates of vaping products and why the Surgeon General refers to youth vaping as an epidemic. We will discuss health risks to youth who choose to use vape products. We'll discuss best practices for parents or guardians on how to talk to their teens and discourage vape use. What is a vape or electronic cigarette? It is a device that heats liquid into an aerosol that the user inhales. The liquid usually has nicotine, flavoring compounds, and other chemicals. The Food and Drug Administration refers to vaping devices as ENDS, Electronic Nicotine Delivery System. Vaping devices don't give off smoke. It's technically an aerosol because of the particles and content that are inhaled and exhaled when using the device. The Surgeon General says that although e-cigarettes have the potential to benefit adult smokers if used as the complete substitute for combustible cigarettes, the use of any form of tobacco by youth is unsafe. We're going to look at the evolution of vaping devices. Pictured here is the first generation of electronic cigarettes. These are disposable e-cigarettes designed to be used one time only. These devices are not rechargeable or refillable, and they are discarded when they run out of charge or liquid. They are designed to mimic and look and feel like combustible cigarettes. These types are still available and are an attractive option for youth because of the cost factor. One of these devices can range anywhere from $8 to $15. Pictured here is the second generation of electronic cigarettes, or e-cigs. These come with pre-filled or refillable cartridges. These are designed to be recharged and used multiple times. Cartridge and battery pack are usually sold together in a starter kit, but they can be purchased individually. The cost of a starter kit can range from $15 to $50, depending on the product. Pictured here is the third generation of vaping devices. These are called tanks or mods. These devices can be used multiple times. They have a tank that can be refilled from a larger container of e-liquid or e-juice. These can be very expensive if users want a larger battery for longer use, or modify it to where they can create more aerosol to inhale. Usually these devices are seen among advanced or experienced users because of their cost and size. They can be expensive, but they can also be as big as a cell phone. Pictured here is the fourth generation and current generation of vaping products. These are pod mods. They come with a pre-filled or refillable pod or cartridge. Pod mods can come in many shapes, sizes, and colors. These are devices that are most popular with young people due to their cost factor and size. They can be easily concealed and may not look like a vape device at first glance. Cost factor is important here because these devices can be anywhere from $15 to $30. Now we're going to talk about youth use rates of vaping products, and I want to share with you where I got my information. Since 1975, the Monitoring the Future survey has measured drug and alcohol use and related attitudes among adolescent students nationwide. Survey participants report their drug behaviors across 3 time periods: lifetime, past year use, and past month use. Overall, in the 2019 survey, which I'm using, over 42,000 students from almost 400 public and private schools nationwide responded to the survey. The survey is funded by the National Institute of Drug Abuse, which is a part of the National Institute of Health, and the survey is conducted by the University of Michigan. Looking at some of these use rates, we can see levels of vape use increased across 8th, 10th, and 12th graders every year since 2016. If we look at 2019 numbers, 24% of 8th graders, 41% of 10th graders, and 45% of 12th graders who took the survey admitted to using vaping devices at some point in their life. Looking at the 2019 numbers, past month vaping, 12% of 8th graders, 25% of 10th graders, and 30% of 12th graders admitted to using a vape device during the last 30 days. So students are experimenting with it. Why are we seeing these numbers for youth using vape products? And there's a few reasons. The first one I'm going to talk about, nicotine is found in many of these products. Nicotine is highly addictive. The amount of nicotine in a single pod or cartridge can be the same amount of nicotine or more nicotine than a standard pack of combustible cigarettes. Marketing tactics. Now, the marketing tactics have been under investigation by the House, the Senate. Individual states like New Jersey, Connecticut, and Massachusetts have brought lawsuits against these companies regarding their marketing tactics. Social media influencers promoting products that young people see is an important concept. Social media influencers are people on Twitter, Instagram, Snapchat. Their followers see them promoting a product that they may believe is safe, and that impacts how youth see these products. Marketing of flavors that are attractive to youth have been legislated in late 2019 and early 2020. Creme brulee, mango, mint. These types of flavors are attractive to youth, and they were marketed that way. Now, the next slide is very important in understanding why they use these products. Their answers might surprise you. The number one answer was to experiment, to see what it's like. The second most common response was because it tastes good. Students also responded they are using vape devices to have a good time with their friends or to relax, relieve tension. Some youth even responded that they are hooked to it. They have to vape. Some students responded to help me quit cigarettes or because regular cigarette use is not permitted. In 2019, the Center for Disease Control and the Food and Drug Administration showed that more than 5 million U.S. youth had used e-cigarettes in the last 30 days. That's why the Surgeon General considers vaping among youth an epidemic. I've heard some youth say It's just water vapor. It's not just water vapor. The main ingredients in e-liquids or e-juice are propylene glycol or glycerin and vegetable glycerin. They are in products all over your house. Deodorant, makeup, frozen foods, toothpaste, mouthwash. These ingredients are approved by the Food and Drug Administration to be consumed either on the skin or through the gastrointestinal system. These ingredients are not approved to be consumed through the respiratory system. Some youth may tell their peers, "Come on, try it, it's harmless." It actually is harmful. Aldehydes are created when propylene glycol is heated. The International Agency for Research on Cancer, acetaldehyde, is one of the most frequently found air toxins and has been proven by sufficient evidence to cause cancer. Some teenagers may say, well, it's safer than cigarettes. Vaping devices don't have tar and they don't have some of the other chemicals that cigarettes have. But that doesn't make it safe. Diacetyl is a flavoring compound and can be found in many vape liquids. It has been previously linked with bronchiolitis obliterans, a debilitating lung disease that was dubbed popcorn lung because it first appeared in workers who inhaled artificial butter flavor in microwave popcorn processing facilities. Nicotine stimulates the pleasure centers of the brain. Your brain starts to associate nicotine use with feeling good. With the way nicotine affects the receptors in your brain, over time, it takes more nicotine to experience the same effect. Exposure to nicotine during adolescence is harmful. It can harm brain development, which continues until about 25 years old. It can impact learning, memory, and attention. It can increase the future risk of addiction to other things. Nicotine changes your brain, which can lead to withdrawal symptoms when people try to quit. When this happens, you may experience a variety of side effects, including anxiety, irritability, and strong craving for nicotine. Can you think of an adult who has gone through nicotine withdrawal when quitting? Now imagine a teenager with hormones that teenagers get as they were growing through their teenage years, withdrawing from nicotine that they got from a vaping device, which was more potent and a higher quantity than traditional cigarettes. This type of withdrawal can have negative social impacts between teenagers and their peers or teenagers and their parents. If someone at your work said that they smoked 2 packs a day, you would think, wow, that's really unhealthy. Wow, that's dangerous. There are youth who are consuming the same amount of nicotine as those people, but they're just using a different device to get it. We're going to talk about best practices for parents or guardians to talk to youth about important subjects like vaping. When you decide to have this conversation, I want you to keep a few things in mind. Parents, when you're engaging in a dialogue with your youth, make sure they know that their health and safety is your main concern. Eliminate any distractions. Turn off the television, put down the phone, sit in the same room, look at each other. Make sure your tone and voice volume are reasonable. This critically impacts how your message is delivered. Sometimes it isn't what you are saying that people hear, it is how you are saying it. Talk with your youth, not to your youth. Engage them in conversation. When they are talking, listen to them, look at them, hear what they're saying. Avoid criticism and create an open dialogue. Your goal is to have a conversation, not a lecture. And it's okay if this conversation happens over time. The most important part is to start the conversation. Tips for parents and guardians specifically about vaping. A teenager says, "Why don't you want me to use e-cigarettes?" Parents can say, "Science shows that e-cigarettes contain ingredients that are addictive. E-cigarettes contain chemicals that are harmful. And when people use e-cigarettes, they breathe in tiny particles that can harm their lungs." For example, a teenager may say, "What's the big deal about nicotine?" Parent and guardian response is, "Your brain is still developing until about age 25. And the Surgeon General reported that nicotine is addictive and can harm your brain development. Using nicotine at your age may make it harder for you to concentrate, learn, or control your impulses. Nicotine can even train your brain to be more easily addicted to other drugs." I don't say this to scare you, but I want you to know, and I want you to have the facts, because nothing is more important to me than your health and safety. If your youth wants to compare e-cigarettes to conventional, traditional cigarettes, make sure they are aware of the difference. A teenager may say, "Aren't vape products safer than conventional cigarettes?" And parents, you can respond, "Conventional cigarettes have harmful ingredients in them, but so do e-cigarettes. E-cigarettes contain higher amounts of nicotine than conventional cigarettes. Whether you get your nicotine from an e-cigarette or a conventional cigarette, it's still nicotine, and that can harm you." During this dialogue with your youth, don't judge or criticize. It may be difficult not to, but you don't want them to shut you down or tune you out. For example, a teenager may say, "Me and my friends have tried e-cigarettes and it was no big deal." That's when a parent or guardian should say, "I appreciate your honesty. In the future, I hope you or your friends will stay away from e-cigarettes. Science shows that e-cigarettes contain ingredients that are addictive and can harm different parts of your body." Next time we go to the doctor, let's ask about the risks of nicotine, e-cigarettes, and other tobacco products. Parents and guardians, use this moment as a teaching moment. Understand that youth won't be able to do better until they know better. For example, a teenager may say, "I thought e-cigarettes didn't have nicotine. It was just water or flavoring." Parents and guardians can say, "I used to think that too, but many e-cigarettes have nicotine, and there are other ingredients and chemicals in them that are harmful." Parents, you can say, "Let's look at the Surgeon General's website on e-cigarettes so you can see for yourself." I encourage you to look at credible, sourced, reliable information about e-cigarettes so you can make an informed and educated choice about this. Another tough question that may come from youth or teenagers is, "You use tobacco, so why shouldn't I?" And that's a tough question for parents and guardians to answer. Structure your response to something like this: "If I could live my life over again, I would never have started smoking." People who smoke cigarettes are much more likely to develop and die from certain diseases. Quitting was really hard, and I don't want you to go through that. So the best thing is to not start at all. Parents and guardians, I want you to think, do you know anyone who uses tobacco who say they're glad they started? No. Adults who use those products say things like, "I wish I never started. I wish I could quit." It's important for youth to understand that. In closing, parents and guardians, I want you to be open and honest with your teenager, but you also need to be prepared to answer their questions. Understand that they may be addicted to nicotine. It's hard for anyone to quit it, especially a teenager. I want you to reach out to your primary care physician for suggestions or tips on how your teenager or youth can quit their vaping products. Being open and honest with your teenager about vaping can help them live happier, healthier lives. Insight Human Services is a 501c3 nonprofit based in Winston-Salem. Insight provides alcohol and drug prevention programs in 13 counties across North Carolina. Insight's mission is to offer the highest quality care to reduce the negative impacts of substance use and mental illness in the communities we serve. We believe evidence-based prevention programs work. We believe evidence-based prevention programs work. We believe treatment is effective. We believe healthy living begins with insight. If you, a family member or loved one, are ready to get help, contact Insight Human Services at 336-725-8389.